Hello, Lyra.
Hi.
We are now about 5 months after your FFS, and I would like to ask you a few things. The first question would be, which problems did you have that made you decide to have FFS?
The biggest thing was there were certain aspects of my profile when you see me from the side that really sort of bothered me, and so it was mostly what I wanted to have mostly done was the nose and the chin and the Adam's apple.
Mm-hmm.
So these were the sort of main features, and then we did the hairline as well, and yeah. I'm quite a lot more comfortable, I would say, and feel more like myself now, which it feels good.
Mm-hmm. What was the reason you have come to me for that surgery?
I came to you because you had a very trusted reputation, and I'd seen your results and talked to some other friends about the quality of your surgical work, and I wanted to do it rather quickly, and we were able to get a consultation very soon, and everything just worked out. So I was super happy that we worked it out this way.
Mm-hmm. You told us a little bit of it already, but maybe you could say a bit more about the result. What has the surgery brought you?
Sure, yeah. I maybe just said this already, but I feel more relaxed, and I feel like I see more of myself in the mirror. I think less about my physical appearance, whereas I used to think about it all the time.
Mm-hmm.
I feel a lot more sort of free, and more able to focus on other things, like friendships and work and things that life is actually about. So
Mm-hmm.
that's positive.
A problem solved. Huh?
Some problems solved. Yeah.
Yeah. Could you tell us something about the recovery and the stay in our guest house? How was it?
Yeah, it was super lovely. I was there for 1 week about. The facility and the guest house and the guest room, Petra, the staff, Ellie, everyone were super amazing, very friendly, very helpful. I felt very at home for that week, and like I was very well taken care of, and it's something that can be super scary. So I think having that sort of feeling of safety and support was super important for me to feel like I came through the procedure in a healthy way.
Mm-hmm. You're also a singer, you
Yes.
told me?
Yeah.
And you told me something about the recovery after the tracheal shave, which I think was very interesting. Could you repeat that?
Yeah, for sure. I think for singers, the tracheal shave can obviously carry some risks. I think with you, since you've done this so much, the risk is not so much. Of course, it's a pretty safe procedure these days. Still, even after a normal, well-executed tracheal shave, I think the recovery time for me for recovering my singing voice was a lot longer than I expected. It's actually still going on.
Mm-hmm.
So speaking came rather quickly, but the singing voice takes a lot more time to align. It feels that there is no real amount of literature that covers how long that can take.
Mm-hmm.
But the good thing is that I'm feeling that the voice is coming back, and I've had to be very patient, and it's longer than I thought. So I think that's also something to consider if you are a singer and you want to go forward with the tracheal shave. I think it's important to know.
Mm-hmm.
Yeah.
You think it will get back to normal 100%? The pitch will be the same, or?
It's hard to say. I mean, I've made some significant progress in the last 3 months, so it's going really a lot better now. But I still wait and see. I saw another ear, nose, and throat doctor who also said with the procedure in a region like that, sometimes it can take up to a year. But I also found out that it's possible that if you are to take too much cartilage away it can compromise some higher pitches with the falsetto voice. And so there is a risk of losing some higher pitches depending on how much you take away. So all of these things sort of go into, I think, the decision making. For me, I wanted to do it no matter what. It was still like, I don't regret doing it. So it's still, I'm really happy that my voice is coming back. But yeah.
Okay. If you could give an advice to your former self before your FFS, would you have an advice, and what would it be?
Oh, would I have an advice? I think I would have said you're going to have to be extremely patient, and you're going to have to be really, the recovery takes a long time. There's going to be things that you can't do, and it'll be emotional, just because any big surgery like this is emotional, but especially with your face, something like this. And I would say be really, really patient, but then I don't think I ever would have been able to be as patient as I ended up needing to be, even if I told myself that. So it's really just something that you go through, I think. And yeah, I'm much more patient now, I think. Yeah.
The surgery made you more patient?
I think so.
Okay.
Yeah.
Another positive effect then.
Yeah.
Okay, last question. If someone that is interested in having treatment with us would like to contact you by email, would that be possible?
Yes, and especially regarding any tracheal shave singing stuff, because I've done a lot of research on this now. And but yeah, generally, if anyone would like to contact me, they can feel welcome to. Yeah.
Very nice of you. Thank you. Thank you also for the interview.
Thank you very much.